Welcome to GTNF 2020 Virtual. Welcome to day 3 of GTNF 2020. I'm Patrick Basham. I have the pleasure of serving as your MC. I know many of you were with us for either day 1, day 2, or perhaps both days. For those who are joining us for the first time, just to let you know that you are currently in the conference hall where our presenters and panelists appear for you and where you can interact with them in our Q&A sessions, which follow just about every part of the program that we run. There is also an engagement hall where you can interact with, it's a booth-like operation where you can interact virtually with the very innovative products that various company leaders in the industry are available. You can have live chats with booth managers if anything particularly takes your interest. I encourage you to take advantage of those opportunities. There'll be at least 2 during this first session of day 3. Also, we have a networking cafe where you can interact with one another on a one-on-one basis or on a group basis in a figurative virtual sense around the table. We're also encouraging our speakers, many of whom are taking advantage of this opportunity, to go into the networking cafes themselves after their presentations and to interact and connect with you in that fashion. In this first session, which is tailored to the Asia Pacific region, and I should say good morning to everyone viewing from that part of the world, good evening to everyone in North, Central, and South America, and good middle of the night to our insomniac friends watching in Europe and Africa. We have 2 keynote speakers in this first session of day 3, and on either side of a interesting and provocative panel presentation. There will be a Q&A after each one of these 3 sessions. The Q&A will work in the following fashion. We will use the questions that you submit, and please start submitting them during the presentations so that we can identify the questions that we need to ask, etc. And if you hit the send button, that will guarantee that we actually receive your question and we can go through them as many as possible in the time allowable. Our first speaker, our first keynote speaker of the session of day 3, I'm delighted to say, is Colin Mendelsohn. And Colin is a board member and founding chairman of the Australian Tobacco Harm Reduction Association, a health promotion charity established to raise awareness of and advocate for safer alternatives to smoking. He was a general practitioner for 27 years and now works with smokers to help them quit. He teaches health professionals, and he's also involved in research. Colin's a member of the expert advisory group that develops the Australian National Cessation Guidelines and was previously the vice president of the Australian Association of Smoking Cessation Professionals, which is Australia's peak body for experts in the field of smoking cessation. I'm delighted to hand the microphone, as it were, over to Colin for his keynote presentation. Colin, the floor is yours.
Thank you, Patrick. Well, good morning and evening to everyone, and thank you very much to the organisers for inviting me to be here to talk about the very sad state of affairs of regulation of vaping products in Australia. Just to declare my disclosures, I have never received money from vaping companies or to the tobacco industry. Our association, ATHRA, has received funding initially to help set up our charity, but since then we have not accepted funding from industry, and we take funding only from the general public. So, moving on, as I said, why I'm here, I guess, is that we're the only international Western democracy to ban the use and possession of nicotine for vaping. And we are really out of step with every other Western democracy in that respect. And in many ways, we're moving in the opposite direction, at least at an official level. And for those of you who don't know, we're the country down the bottom corner there. So that's Australia and New Zealand next to us, which has a very different policy. Australia regulates vaping products under 3 separate types of laws. It's a very complex situation, but there's poisons laws under which nicotine is classified as a very dangerous poison in the categories of arsenic and strychnine. And so because of that, sale of nicotine, possession and use of nicotine are criminal offences. So that's the first set of regulations and laws that apply. Secondly, we regulate nicotine as a tobacco product with the same sorts of restrictions. So that means the age of purchase, bans in smoke-free places, no advertising, you can't vape in cars with children, that sort of thing. So it's entirely not proportionate to risk, but that's a historical set of laws that vaping has been lumped into. It doesn't have its own legislation, of course. And finally, there are therapeutic options. So there is the option of individuals being allowed to import their own nicotine for personal use if they have a prescription. Now that might sound reasonable, but no one has a prescription. So the idea of getting a prescription just is not working, and people aren't doing it. So officially, they're actually criminals in the way that they're using their nicotine. There's another option that our opponents say, well, of course, we should just get these products regulated by the regulator, and then we'll know they're safe and effective. And if a company did take a product to the regulator, it would be passed, approved, could become a prescription product. But of course, that's not going to happen, and we all know that, and it hasn't happened anywhere in the world. So it's used as a way of saying, oh, we're not banning nicotine, you just need to present them for regulation. But that's not going to happen. So one thing AFTA has done recently is develop a preferred regulatory model, and this is based a lot on the UK and on the proposed New Zealand models and input from various experts. But basically, we want nicotine liquid up to a certain level. In this case, we think 5%, available as a consumer product. So smokers can access it for quitting if they can't quit in any other way, and to minimise any exposure to kids. So that's the principle behind our model, and it involves safety standards, which we currently don't have, manufacturing standards, labelling, health warnings, childproof caps, all the things we don't have because this product is banned. We'd like to have a pre-market notification system like they have in the UK, and which is planned for New Zealand, and a reporting system for problems, and a recall system for products that need to be obviously taken back. Our biggest barrier in Australia is this man, our health minister. He made a commitment very early, and we're talking about 3 years ago, that this was not going to happen on his watch. So he's kind of already committed himself very early on, and unfortunately continuing to do that. And more recently, he said, the most important thing I do as health minister is not to allow nicotine into Australia. So you can see that at the very highest level, we have a huge barrier, which clearly appears to us to be not negotiable. And I think it would be very hard politically to change tack. And that's perhaps our biggest barrier. But it's not just the health minister. So in Australia, we have almost universal resistance to vaping. So that includes our Australian government health department, the top left logo, our peak health and medical organisation, the National Health and Medical Research Council, our regulator, the TGA, are all opposed to vaping. We don't have enough evidence, apparently, or they haven't seen it. We also have resistance from all our state and territory governments. We have 7 local regulatory divisions who all oppose vaping. Most of the medical and health associations oppose vaping, including the Australian Medical Association, Thoracic Society, Public Health Association, and even the health charities. Believe it or not, Cancer Council Australia opposes vaping, even though smoking is the leading preventable cause of death and illness in Australia. It's also opposed by the Heart Foundation, the Lung Foundation, and it goes on. And the effect of this is amplified by the fact that the media is hostile to vaping. So the dominant narrative gets covered in the media. We find it very hard to counter that. And what's particularly disturbing is that our leading medical journal has an anti-vaping position. It's very hard to get pro-vaping articles published. I've submitted several to them. One was rejected without even peer review, published subsequently by a leading journal. And you know, it's not for me to say there's a bias there, but a lot of people feel that there is. But the result of all this is a very serious human cost. And what this graph shows is the rate of decline of smoking in Australia, which is the red line, in England, the green line, and in the US, the blue line. And these are official statistics. And you can see in Australia, since 2013, when vaping became more widespread, the rate of smoking in Australia has pretty much flatlined. It's falling, but marginally. Whereas in the US, the blue line, it's accelerated. The research shows that, and the same in the UK, the green line. And to quantify that, the rate of decline since vaping became available globally and became popular in Australia has been 0.3% per year, which is about a third of the rate of decline in the US and the UK, where vaping is very prevalent. And we can't say for sure all of that's due to vaping, and I'm sure it's not, but it's clearly playing a major role because Australia is doing everything else. We have very strict tobacco control laws, the highest cigarette prices in the world, plain packaging, and yet smoking's not changing. Other impacts of the de facto ban we have is that people are importing very high concentrations of nicotine and mixing it in Australia with locally purchased nicotine-free liquid. And that creates poisoning issues. We have had problems with that. In countries where vaping's discouraged, there are lower quit rates, and I'm sure that applies to Australia. It's not supported, people feel worried about it, and so it's not as successful. It's not easy to get accurate information. And of course, there's a black market. You can order it from overseas, but for many people, that's too difficult. It's easier just to go to the local markets and be given something that you're told is what it's supposed to be, but who knows what's in there. One really disappointing aspect of this is that vapers have become very angry and disillusioned about this. I mean, after all these years, they've finally found something that's worked for them, that's life-saving, and the government says, oh no, you can't quit that way, you have to do it our way. And people have lost a lot of confidence in government. They see this as a money grab by the government for the taxes, and that's really, at a society level, I think that's a really harmful outcome. One of the things that's happening is a lot of the Australian businesses are going to New Zealand because in New Zealand you can sell nicotine. So they're going to New Zealand and selling it back to Australia. So not only is this a lot more difficult for Australian vapers to access, but it means that we're losing all the economic benefits in the middle of a very nasty recession. We're not getting the taxes, we're not getting the business stimulation, the opportunity to grow that business. So these are other impacts from this, this silly law. And not only that, if you're caught with nicotine, just possessing it, there are substantial penalties, up to $45,000 for an individual offence, up to 2 years jail in 3 jurisdictions. Now, these penalties aren't being used regularly, but they're hanging over vapers, and you'll get a criminal record if you're caught with nicotine and it's enforced. So that is a big discouragement for people to not use nicotine. But in spite of that, and maybe this is something about the Australian character, vaping rates are increasing rapidly. The yellow line shows that vaping in the last survey, in the most recent survey last year, national survey, was 2.5% of the adult population, the numbers more than doubled since our survey in 2016, and you can see the number of vapers now in Australia is 500,000, over 500,000, which is pretty extraordinary given the risk that people are taking. And when you have a choice between a 2 in 3 chance of dying from smoking or potentially being picked up under criminal law, many people are choosing vaping, although of course many aren't who should be. And our level of vaping in Australia is relatively respectable compared to some of the other countries, some of the other Western countries, and that's what's shown here that we compare ourselves with. As in other countries, vaping is mostly taken up by young people, so in the 20s, early 30s, but particularly in the 20s. And what's interesting is that in our latest national survey, the biggest declines in smoking occurred in those age groups, in fact in the 20s and early 30s. And you don't have to be a genius to realise that there may be a connection between the high vaping rates and the reduction in smoking. And clearly vaping is a substitute for smoking. We had no reduction in our last survey in smoking rates from people over 40, and they're the ones we need vaping to be available for. So the young people are certainly taking it up, and it seems to be helping their smoking rates. Like in other countries, uptake by young people is very low. So in our survey, national survey, amongst teenagers, 1.8% were current vapers, and our definition of that is they vaped at least once in the last year, which is a bit of a silly definition. But only 1.3% of kids who never smoked had tried e-cigarettes, and that includes non-smokers and ex-smokers. But most of those, of course, as we know, are experimental. Many of them don't use nicotine. So the real risk of regular use is actually very small, or that wasn't measured. But in other national surveys, we know regular use amongst young non-smokers is very low. And like in other countries, the rate of uptake by never smokers is also extremely low. So 0.7% of never smokers had tried a vape in the last year. Less than 0.3% of never smokers were vaping regularly, which is defined as weekly or more. So although these arguments are widely used in Australia, think about the children, the risks, what about non-vapers taking up nicotine and all the harm that's going to do, it's actually not happening. And when you look at the evidence, it's pretty clear. So for 5 years, we've been fighting this. There are 4 main advocacy groups in Australia. There's the Australian Tobacco Harm Reduction Association, which is a medical and scientific group. Legalise Vaping, which is an advocacy group with a libertarian focus. There's now an industry organisation and a private public health organisation, the Progressive Public Health Alliance. And we've been using mostly low-cost methods. We don't have a budget, unlike our opponents, we have very little. But we're making progress with social media, mainstream media. We are having opinion pieces published. We're getting vapers engaged, although that's difficult. Certainly talking to politicians, running campaigns, and educating people. When misinformation appears in the media, which is frequent, we challenge that. We make submissions to inquiries, put out petitions, and so on. So we do what we can, and I think we're actually making some progress. We do have now media supporters who get it, who aren't confused by this dominant narrative. They look at the evidence. We have political supporters who don't understand how this view has become so dominant, who support our campaign. And we actually have 3 medical associations who get it. The psychiatrists are strong supporters. The College of GPs and the College of Physicians have come on board, but they're kind of ambivalent, and they don't want to get isolated from the rest of the groupthink organisations, as far as we can tell. But in June, we had a big boost in our campaign. The Health Minister kicked an own goal. So what he decided was, in his infinite wisdom, that we should ban the imports of nicotine into Australia, and there should be a $220,000 fine if you're bringing nicotine into Australia to help you quit smoking. And he produced this complex and unworkable pathway. I won't go into the details, but it was ridiculous, and there's no way it would work. This was introduced with 2 weeks' notice. At the end of Parliament, there was no parliamentary discussion, there was no public consultation. So the Health Minister thought, well, we'll just push this through at the end of Parliament when no one's looking. But people did see it. And what happened was that there was a huge backlash. The vapers were so angry with this. They melted the phone lines to the MPs and sent in emails. There was a fighting fund developed. a lot of social media, some of the advocacy media jumped on this, opinion pieces were published. And within the parliament, even within the government, there was a huge backlash. So these two senators, or one's a senator and one's a member of parliament, wrote a letter to the health minister signed by 28 backbenchers from within the government saying this is not acceptable. Within 3 days, they put an online petition and they got 70,000 signatures. So that was the extent of the response. It was a huge response, and the minister backed down. Legalised Vaping did a survey of 7,000 vapers. They found that 42% said they would go back to smoking under this model. They said that 37% would go to the black market, and 95% felt this was a decision which would influence their vote. So the backlash was very powerful, and that's politically very powerful. So Mr. Hunt caved in, and he's not said, no, I was wrong. He said, look, we're just going to defer this for a bit more, this consultation. There has been no consultation, and we're just waiting to see what happens in January. He's providing us no details, and this is a moving target. We don't know how to address this because there's constantly changes to the plan. We don't know what's coming. But at the end of the day, this is now a political decision. So we know we can't change the positions of the bureaucrats, the health departments, or the medical associations and charities. They're dug in to this groupthink argument. They're impervious to evidence. The evidence just doesn't get through. They have their own evidence, and it's not evidence-based, but the media sort of accepts what the Cancer Council says it's a sacred organisation. They do God's work. It must be okay. And the precautionary approach is behind all this. We just don't have enough evidence. You don't want to make a decision that you might regret. So at the end of the day, this now becomes a political decision. So we're not going to change the bureaucrats, but the politicians are getting it. And they will decide. And they'll decide for a couple of reasons. One is that vapers vote. And we now have a lot of vapers who will vote according to this issue. And as we know from the US, vaping for many people is a single issue voting thing. So if you know this is going to save your life, you'll pick a party that supports you. And I think politicians are starting to understand that, but they also understand the evidence more and more. And we've all done our share in trying to educate them, and they say, well, this is clearly safer. It should be more accessible than cigarettes. Why are we the only country that's making it harder for smokers to quit? So we think in Canberra is where the decision is going to be made, and we're hoping the MPs will stand up for this. And so far the evidence is promising. I just wanted to mention the people that I work with and give them credit. Alex Wadak is well known as a warrior for harm reduction over many decades. Joe Kosterich is the current president of our organisation. Legalised Vaping does a wonderful job in advocacy and in mobilising vapers and vendors, particularly Brian Marlowe, but the others all work very hard. They're very dedicated. And the Public Health Alliance also in Melbourne, Gavin and Stephanie also do a great job from a different direction. We all bring different skills and work together, and I think it's having a positive outcome. So that's all I have to say. I'm very happy to take questions. Do you feel the proposed SASB prescripted pathway will stay with Mr. Hunt's Prohibition Act? So currently, up till now, the pathway has been people are meant to go to a doctor and he writes a regular script and then they can bring in nicotine. What Mr. Hunt has suggested in his initial ruling in June is that doctors need a much more complex process of getting a prescription. So it means going to the doctor, he has to apply online for an application, and some days later that's approved, the patient has to go back and get a prescription. And under the original plan, they then had to go to an importer who would get an import permit for each occasion, import it from overseas, they would buy it, sell it to the doctor who would sell it to the patient. I mean, it's just ridiculous. And I think the idea, it's just making it too difficult for people to get a life-saving product. So no, I don't think that's going ahead. I think they realise that that's just not workable. What's been the reaction in Australia to the use? US EVALI issue, and was the initial coverage vape focused without the correction? This has been very disappointing. Back in September, our Chief Medical Officer and Health Department put on their website that vaping was a risk to the lungs and people were dying and getting serious lung diseases. It became very clear not long after that this was a vitamin E acetate illicit THC product, these outcomes. That warning is still on the government website. Still on the government website. We have written to them and said, look, this is not appropriate anymore. Even the CDC admits that this is not a nicotine vaping problem, but it's still listed, and that's the official position. So that's the sort of misinformation we're getting. I'm happy to take any other questions. Derek says, how does the new evidence that plain packaging led to increased smoking affect people's trust in the government policy process? Yes, there was a study that came out yesterday saying that smoking hasn't significantly reduced since plain packaging came out. And I think the figures I've showed you suggest that. So since 2012, when plain packaging became available, our smoking rates have virtually flatlined. And that's with the highest cigarette prices in the world and very strict tobacco control laws. So I think looking back, I can't see any evidence of an effect. All the evaluation has been done by the Cancer Council and people with a vested interest in plain packaging. So, you know, people have questioned the independence of that evaluation. So, and this recent data suggests, I know it's been criticised, and Simon Chapman and the CEO of the Cancer Council were on the radio yesterday saying what rubbish this study is. I haven't looked at it closely, but you know that response was predictable. Simon Chapman's response was that this is probably funded by big tobacco, although that was denied. But the evidence, from what I can see in smoking rates, hasn't shown any significant effect. How do you think the recent New Zealand regulatory framework for vaping will influence the final Australian Health Minister's pathway? We think what they've done in New Zealand is excellent. It's not perfect. They're obviously being cautious. I don't think the restriction in the dairies and the newsagents and the retail outlets is appropriate, and I do believe that there should be some advertising of vaping, you know, responsible advertising to adults to make them aware of vaping, not to young people. So I think that's gone a little bit far, but in principle we support what they're doing, and our regulatory model that we have developed is based very much on what they've done in New Zealand and the UK, which I think is very sensible. So why have vapers in Australia been so successful in mobilising where efforts elsewhere appear to struggle? Look, Australians have not been successful in mobilising up till now. We haven't got a nicotine consumer group in Australia, there was one for a short while, but kind of imploded. And it's very hard to mobilise vapers. What they'll often say is, look, I've got 2 litres of 100% nicotine, 100 milligram per mil nicotine in the fridge. I'm right for 5 years. I'm not worried. But what we're worried about is the 3 million smokers who don't have access and the people who can't get nicotine that way. And it's been very hard to get the vapers to look beyond their own needs, we've found. But this recent threat is one that has really mobilised them. How does Australia regulate nicotine patch gum and spray? We have this ridiculous, irrational, unscientific approach to nicotine in Australia. So in Australia, nicotine is a dangerous poison, but it's specifically exempt in tobacco for smoking. So we're saying, look, it's dangerous, you can't have nicotine, but you can have it in the most deadly delivery system, and that's ridiculous. You can buy gum and patches from the petrol station from the age of 12, where it's approved, from the age of 12. But you can't buy. Adults who can't quit, who would otherwise continue to smoke, aren't able to buy low concentrations of nicotine liquid to quit. So it's terribly inconsistent, and it needs to be revised.
Thank you, Colin, both for the presentation and for cheerfully handling both elements of the Q&A. We now have, you're going to all be moved in the audience, you're going to be moved into the engagement area where you once again can go into the engagement hall or go into the networking cafes and interact. Hopefully Colin will be able to make his way into the networking cafe, and he continue to answer questions and connect with as many of you as possible. It's a relatively short opportunity, not at 45 minutes after the hour. We will be beginning our panel on grassroots consumer rights advocacy. I'm sure none of you want to be late for that opportunity. So between now and 45 minutes after the hour, if you would kindly, in your agendas, click on the link for that panel, and we will be delighted to see you at that time. Thank you so much.